I'm here with Dr. Teresa Frankovich for the Monday, April 27th media availability. Thank you for being here.
Thank you.
On Friday, you shared photos on Facebook that a new alternate care site is being set up at Redwood Acres by the Governor's Office of Emergency Services. Can you explain what the intended use will be? And is this a requirement either for the county or at a state level that needs to be followed in order for restrictions to be lifted?
Yes, so it's actually an effort, I would say, on the part of jointly OES, Cal OES, and CDPH from the state. And yes, it is one of the components in the governor's framework, that readiness for surge, for a marked increase in cases that could exceed the capacity of our hospitals, even as they have built out their capacity. So it's an important piece for us to have in order to be able to move forward.
Okay. A new testing facility in Eureka is slated to be up and running in the next week or so. Will testing criteria be the same as it has been, or will the new site allow for more people with milder symptoms to be tested?
It's a really exciting development, and we actually have folks on site to get this up and running. And what I will tell you is that we're one of the first in the state, and so it's a work in progress to kind of make all the systems work smoothly. But I actually anticipate within the next couple of weeks that the ability for people to sign up to be tested online will be there, and that the public will have access to testing at that time without needing to go through a healthcare provider to access that. So we're very excited about that. What we are starting with is doing some surveillance testing on people without symptoms who are in our first responders, healthcare workers, high-risk groups, including, for instance, skilled nursing facility staff, other congregate setting staff. So we're using this opportunity to get all of the pieces in place to screen some of those folks with the intention that we will have that access for general public as quickly as possible. So we'll keep everyone posted.
So I think you kind of spoke to this already, but this next question is, on Friday you said in a news release that there will be the new testing facility provided by the state, that the county will be able to test mildly symptomatic people and eventually people without symptoms. Given the ongoing difficulty of acquiring adequate supplies of testing resources, when do you expect to be able to conduct the surveillance testing and contact tracing?
So yes, again, the goal is to be able to test not only mildly symptomatic people, but my hope is to be able to test people without symptoms at all from the general public. We want as much information as possible about how much of this virus is out there in the community, and that will help inform everything we do. What I would say is that the supply chain is improving. We're seeing that in our own internal lab. The governor's task force has been really helpful in, I think, moving some things through the supply chain. That being said, when we're doing these collection sites, they do have to go to commercial labs or other types of large labs. And so we need to make sure that those labs are going to be able to report in a timely way and that we can act on those, because we already are doing contact tracing. We just want to make it as efficient and fast in terms of identifying and tracing people as possible.
The FAA is set to award the county's Department of Aviation more than $17 million in CARES Act funding. What would the county's Office of Emergency Services and/or Public Health Branch do with a grant of that size?
Well, it would be a good problem to have. So I would say that right out of the gate. I would also say that for us, in this piece of the response that we've been working on, one of the really big issues has been access rather than funding, per se. And so it is that problem of being able to get, reagents, swabs, all those things that no matter how much money you had, really probably wouldn't have been available to purchase. So as the governor's task force has worked on this, I think that supply chain has improved. I think we're getting access to, for instance, alternative care site things, testing things that we need. And I expect that to get better with time. But again, I will ponder that $17 million, and I'm sure I have a lot of good ideas on how we can use that going forward.
Excellent. With construction having begun on the 100-bed alternate care site at Redwood Acres and local hospitals' efforts to expand capacity, can you offer an update on efforts to bolster the local healthcare workforce to staff the new site and additional beds?
Sure. So you're right. It doesn't matter how many beds we have if we don't have people to provide care. So this has been a big focus of our planning. We obviously are in conversations with healthcare partners that are both inpatient, outpatient settings across our county. and thinking about use of our volunteer, disaster service volunteers, any of those entities that we can reach out to. So our hope is to both harness some retired individuals, people who are still working, and be able to have that robust team approach to this care. And I think we're doing really well on that front.
State Senator Mike McGuire tweeted this morning that the priority for the Optum testing site, which we discussed a few minutes ago, will focus on testing hospital personnel, nursing home staff, and skilled nursing facility teams. Can you confirm this will be the case?
Yes, absolutely. And again, we're taking advantage of sort of our little startup period with this to get some of those folks screened. And, our healthcare workers obviously are an important area of concern because of their exposure to patients, and as well as nursing home staff because of the potential of outbreaks in congregate settings, which we have seen play out in other areas. So it's a very high priority group for us to test.
On Friday, more than 20 people protested at the Humboldt County Courthouse against COVID-19 shelter-in-place requirements, demanding a reopening of the county. What would you tell the protester who blatantly violates your order, arguing that the shelter-in-place is more dangerous than the virus?
Well, I guess two things come to mind. One is that it's really not possible for us to always know who is at risk among us, who's at more risk of serious illness, people who have underlying medical conditions that make them a real person of concern as we go forward. I mean, none of us wants to get COVID, but some of us are more likely than others to do well, and some are more likely to have really more serious disease. So I guess I would ask people to take that into consideration and socially distance and mask as we've asked them to do. On the second point, I think that it's really not an either or type of thing. The virus is real. We've seen how the virus has played out in terms of hospitalizations and deaths in many parts of the world, including the United States. And so we know that has a cost. We also know that the social measures that we've put in place have a cost as well for our community. So that's why we just have to make it a balancing act as we move forward. We're going to accept some illness on the trade-off for knowing that we have to begin some of these other steps.
How do people experiencing homelessness get facial coverings, and are there any resources for that in the community?
So yes, we've been working on that aspect as well, and there are some of our folks who work on the front lines with homeless individuals have been armed with masks. So we're really working to distribute those to homeless individuals. But I do want to point out that, again, the order goes to facial coverings. It is not masks per se. And so some of the strategy for helping people is just to help people realize they have many of those materials on hand that can help provide that same effect without having to purchase a mask or even have one on hand at that moment.
Excellent. There are places around the county where people appear to be congregating in larger groups, such as on the jetties or at a farmer's market. Are there concerns that the use of masks or facial coverings is spurring some inadvertent relaxation of social distancing?
Well, I think, people are eager to get out, and I understand that. It's been, a month or so of this, and that's been difficult. I think social distancing is it's a new learning curve for us, that maintaining 6-foot distances and getting people, all of us really, to be smart about that, remembering that at all times is really important. And it's a learning piece. So I think we've gotten better and better at it, but I think we're going to have to do better. And of course, the mask only really has utility if we're distancing. We really have to do it in terms of in that moment. If you're close together and wearing a mask, is it better than not having a mask on? Sure. But it really, to be most effective, you need to have both. You need the distance and the mask or facial covering.
Last week you stated that antibodies from COVID-19 positive patients who have recovered are being used as a potential treatment. Can you share an update on antibody research?
Well, the antibody piece is really interesting. Just to give people some ideas, we use antibodies to treat other things. For instance, with rabies exposure, we know people don't walk around with antibodies to rabies, most of us. And so when someone is seen who may have had an exposure, we do two things. We give rabies immune globulin, which are rabies antibodies, through an injection, and we give vaccine because we know it takes probably a couple of weeks for the vaccine to be effective. The antibodies give you protection right away. We also have a disease called respiratory syncytial virus that tends to cause severe respiratory breathing problems in particularly premature infants. We actually use RSV immune globulin for those babies as a preventative measure during the season where RSV circulates. So we know that these can be effective treatment, and those are basically clinical trial protocols are going on around the use of plasma, which is given to basically deliver antibodies to patients with serious illness. So, there isn't really much out there right now about effectiveness. There are some small anecdotal reports that seem to say it may be very promising, but we just don't know yet. But we're going to learn a lot more very quickly.
What do you think of the daily briefings from the White House, and do you believe that they do more harm than good?
So, I think communication is good. I think we need to hear from Washington about what's happening. I think that, as we move forward, I think it's really important that we just keep our focus on evidence-based practices to guide our way through this. It's just routine practice in medicine and healthcare, and I think we need to really hold to that now because obviously we're trying lots of different things to see what might work, but it has to be guided by some scientific principle.
How many people died of flu-like symptoms or pneumonia in January and February of this year in Humboldt County? How does it compare with previous years?
Well, we've asked our epidemiologists this along the way, and this last flu season was actually lighter than the previous years in many ways, and we actually had fewer deaths than we did. And so I think, does that mean that none of those could have had any relationship to COVID? No. It'll be an interesting piece to look back on and see when we have, some ability to do some retrospective looks. But right now, we don't have any evidence that COVID was really impacting our flu season this year.
Excellent. Thank you so much.
Thank you.